Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
And I want to know from you, how do you ask? I want to know, how do we find out that they're going to look at it and with your eyes and say, is it fair? Because I see a lot of ABA providers who don't understand that. So what's the question that would get to that to see if they understand that concept?
I don't know. Yeah, I mean, so here's the problem. Coming, and I'll put on my ABA hat for a minute, right? Okay. And I'll say.
And by the way, Gina has written in and said, "Good morning. What is ABA?"
Ooh, I love that. Applied behavior analysis, Gina. And I will, after I finish this question, I'll probably talk about that for the next 15 minutes or so. So just bear with me, Gina.
Yeah, stick with us.
But so as a provider, I want the parents to know that the minute you start asking a lot of questions, a lot of the providers become defensive. Yeah. And they are in a position right now where there's like a huge need, right? I mean, there's wait lists everywhere. And so it's a little problematic to make them defensive, because they're kind of, providers are in a very arrogant space right now. And they're kind of like, it's got to be my way. And, you got to just deal with it. And that's that. And so it's very, very hard. And what Shannon also said is very true, is like a lot of these providers don't even have time. So they will take you on as a patient, and then they're supposed to provide you 20 hours and they provide you 10. That's a problem too. But I don't know that there's a question that will help determine if the provider is looking at things in a fair way. And what we mean by that is this: you never want your child to go through an intervention that doesn't make sense to you. So the provider must have taught it to you and explained it to you first. That's really important. I would never do anything with any of my kids if the parents didn't understand exactly what I'm trying to accomplish, because sometimes the kids will go through, and some of you will know this, they'll go through hours of crying, and your ABA therapist will say, or BCBA will say, let them cry. It's okay. But as a parent, none of us are willing to let them cry unless we know why we're doing that. Unless we know that we're letting them cry because if we don't, then they're learning to cry as a form of communication. And it's important that we understand all of this. And then we as parents, like when I observe, Shannon, is when I really learn whether someone is treating a child fairly, because the amount of, I guess, stress, ABA is all about teaching a lot of stuff, right? I want to teach you not just challenging behaviors are not okay, but I want to teach you all the right language, all the right social, all the right adaptive, all the stuff you need to become your own age level. So I'm going to give you intensive tutoring. So there's a lot of demand. There's a lot of pressure. So at the same time, there's got to be tons of reinforcers. That's how you make it fair. If you are pushing a child, you need to make sure they're feeling really rewarded as well. And then the child will let you know if it's fair, because the children who are getting good ABA are generally happy. They're not going through a rough time forever. Maybe the first 6 months when they're adjusting is a little tough, but they're generally actually looking forward to it, because that's where they learn and that's how they benefit. So Shannon's right. It's very important to make sure you have a fair program so your child is not continuously unhappy. They have moments of stress, but they also have moments where they feel very accomplished and feel good about themselves.
And are having fun.
And they're having a great time. Exactly. Yeah. So I would say, Shannon, along with that, you made me think that a good ABA program has a lot of meetings with the team. That is important for supervisors to change the program continuously. Like when I work with a child, and if the child is having a really hard time and it's already 2 weeks of that, I'm going to change the program. I'm not going to blame the child. I'm going to say there's something wrong with the way we're teaching. We either have to increase the reward, we have to make it easier, and we have to make sure this child is looking at the model and learning. So modifying your program constantly is a really key feature of a good ABA program. Actually, Shannon, didn't we write about this?
We did, and I just haven't published it yet, but it's coming. I know I keep saying that, but April is coming. I got to get it published in April.
Yeah, great.
Everybody should fire me. Everybody should write in and fire me if I don't get it published in April. It's just like heinous and there's no excuse. So I'm not making any. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.